Thank you very much. I feel honored to given the opportunity to present our work in the scientific program of APPI Award Function 2020-2021. The title of our work is Recording of Length Tension Relationship of Elbow Flexor and Extensor by Varying Elbow Angle in Human. It was done under the guidance of Professor K.K. Deepak and Dr. Prashant Tayade and helped by my colleague Dr. Arani from Department of Physiology, AIMS Gorakhpur. I am Hanjabam Barun Sharma. I am from Department of Physiology, IMS BHU, and this work was published in the IJPP in supplementary session, supplementary issue of 2020. So let's start the session. So before beginning, I would just like to give a brief introduction and background regarding the length tension relationship, which classically we used to do in practical of physiology. We used to do with in vitro sciatic nerve gastrocnemius muscle preparation of frog, but the problem is because of the unavailability of the frog as well as the ethical issues which is related with the killing of the animal is a major setback in this. So we were thinking what should be an alternative which is approximately, make as an alternative to this classic and very useful practical. So we try to develop a simple and innovative as well as feasible alternative using the concept of isometric strength curve in human. And for this, we actually designed a custom-made isometric exercise equipment, EIE, and this instrument was basically used to do isometric exercises, different joint angle, and using that we will develop the practical, which may be an alternative to the classic length tensor relationship. This is the all length tensor relationship graph which we already know, where the total tension, active tension, passive tension, everything is there. But unfortunately, in our alternative, this different component may not be able to differentiate. So, what is isometric strength curve? The isometric strength curve is actually is a graph between the strength versus the joint angle. That is the strength which we actually measured is nothing but the torque acting by the muscle on the bony segment. Torque, as we all know, that torque is the force into the moment arm. Moment arm is the perpendicular distance from the axis of rotation to the line of force. So the force here, the force here is the internal force generated by the muscle. And this momentum, from this diagram, you can see that the momentum, this is the axis of rotation. Suppose this is an example of the elbow, where bicep is there, which does the elbow flexion. Here we can say, see that you can see the axis of rotation. This is a line of action of the force. So the perpendicular distance between them is the momentum. Momentum here is indicated by the M. So when we see that when the bicep flexion is there, the momentum tend to increases during the flexion within a particular range, because after that it again tends to decreases. So in the normal physiological condition, in approximation, we can say that the moment arm changes with the joint angle. This is important. Another one which we want to highlight, is we already know that there is a relationship between the tension and the length of the muscle. So you can see that when the length of the muscle is affected by the joint angle also. Here you can see that when extension is there is stretching of the bicep. So in this way, we by using that length tension relationship, we can say that the force, internal force, that is the force generated by the muscle, will be dependent on the angle. So the total force or the total torque on this bony segment, which will be measured by using an the external isometric hand grip dynamometer, it can be affected by the force which is produced by the muscle as well as the momentum. Why? Because the torque is the force into momentum. So by using this concept, this is just an hypothetical example. Just an hypothetical example, when we draw a graph between the momentum and the joint angle, we can say that as the joint angle, the moment up is greatest when the joint angle here is the difference between this one here. The angle is little bit different here. So here we can see that when the joint angle is lesser, Lesser means it is here. Here means this one, flexion. Then what will happen? The moment arm is greatest. Then if we keep on extending, the moment arm decreases. We are not considering this part because this is just an hypothetical example. Okay. So the flexion regarding inflection, the moment arm is increases, whereas it decreases as we increase the angle, joint angle, that is during the extension. But here we can see that the stretching of the muscle is happening at the extension. That means if we take an example of the classic length tension relationship, the muscle, the force produced by the muscle should be opposite to this one. Because the stretching is happening at the extension. That's why the force is greatest during the extension, this part. So since the strain curve is the combination of the both, so approximately we can say that it may be inverted U shape, or it may have different the graphical presentation depending upon the relationship of the momentum with the joint angle as well as the force with the joint angle. So this is an hypothetical example where inverted U-shaped curve is there. So strain curve, it depends upon two factors, three factors. The first one is the biomechanical. That is very important. The length tension, classic length tension relationship, and it is also affected by another parameter, something new, if we introduce to an MBBS, then although they have already learned this concept in their class 12 physics. So it is affected by momentum and angle relationship and the length tension relationship. It is also affected by other factors like neural factor, where motor unit activation, recruitment, and discharge frequency is there, and other factors like muscle cross-sectional area, architecture, etc. So this may affect the whole strength curve also. But assuming that other parameters are relatively constant or doesn't change that much, then we can indirectly, alternatively approximate that the strength curve may be affected by length tension relationship also. So by extrapolating this thing, this 100% is not accurate, but still we can extrapolate the thing, so that we may not be able to, animal experiment and killing of the animal, so that it may become an alternative to the classic example. So the method which we use was this one. This is a custom-made instrument for isometric exercise. It can be rotated in full 360 degree, and this is an isometric dynamometer which is connected to the power lab. There is ADI instrument. EMGs also we recorded because we intended, to see what are the changes of the EMG happening with different joint angle also, and these are the different setting. So the most important three things is there. The first one is the measurement of the joint angle. Measurement of the joint angle here in this case is the joint angle of the elbow. It is done by the goniometer. And isometric strength, it is recorded by hand-grade dynamometer of ADI instrument. And the most important which we custom made is the doing isometric exercise at different joint angle. So this is done by our custom-made isometric exercise equipment. Here, the range of motion of the the elbow is approximately 0 to 150 degree, and we try to record as much as isometric strength at different joint angle. And basically we want to avoid the fatigue, so a sufficient time interval was given between many recording, like between different joint angle. We more than 3 minutes was given, more than 10 seconds was given for shoulder flexion and extension at a particular angle, and whole the sequence may be repeated after more than 5 minutes, so that we may have more than one recording of the whole session. So this is the isometric exercise equipment which we made. It consists of different parts. The most important the thing is here is the part A, where we introduce our forearm. But here this instrument can also be used to record the quadricep and hamstring also. Here we have not shown the quadricep and hamstring strength curve, but it can be done. It can be done. And this instrument patent was filed on 17 September 2020 under Indian Patent Office to National Research Development Corporation, New Delhi. And these are the patent details. And the inventors were Professor K.K. Deepak and myself, and the applicant was AIIMS, New Delhi. So this was the result which was published in the paper, which you can see that the isometric strength curve, and with the joint angle in degree. This is this one, and This is for what you call the elbow flexor and elbow extension. We can see that they follow a particular inverted U-shaped curve, and the angle where the maximum isometric strength was there recorded is also known as the optimum angle. The optimum angle here in this case, both flexion and extension, is approximately 90 degrees. But one should remember that this is just the recording of the one subject. But it may not be inverted U shaped as always. Practically it may differ. So we want to see whether it is actually inverted U shaped or something is there. So for that we have taken data. It is still continuing, data collection is still continuing, but I am just showing the data of 29 subject here, and you can see that the classic inverted U shape is not there, but still we can get the approximate peak of the isometric strength at around 90 degree of the shoulder flexion. So this is the red one. Red one is the maximum strength, and the blue one is the mean. Means because we have asked the subject to do maximum contraction for 5 seconds. So this is the recording. But however, when we see the extensor, elbow extensor, we can see that it is actually increasing, and we are not able to see the particular peak. Still at around 90 degree, it is there. The optimum angle is approximately around 90 degree, but the issue is we have to decrease the joint angle so that we may be able to smoothen the graph, and we will require more data collection for more subjects so that we may be able to see the entire picture. So the optimum angle is approximately 90 degree for elbow flexion and extension. Now we have also taken the RMS of the surface EMG of bicep during the elbow flexion. This is the this is for the tricep, as well as this is for flexion. This is for extension. So bicep and tricep. Sorry for the typing and adding. So this one is for tricep. We can see the surface EMG of RMS, that is root mean square. You can see this is done for 21 subject, and it is approximately inverted U shape is there. But in case of the flexion, where bicep RMS is there, it is not so. So we don't exactly know what is happening here, but just we want to record. We want to see the profiling of the motor unit activation by measuring the EMG, so that this can be introduced for PG practical as well. So this is the one. And again, since the bicep and the tricep, they crosses the shoulder joint also, so we want to see what is the effect of the shoulder joint when we do elbow flexion and extension at a particular elbow angle. So this is the reason of that. In this graph, you can see that this is the isometric elbow flexion strength curve at different shoulder angle, like flexion, neutral, and extension. So here you can see that difficult inverted U shape is not there. It is in fact increasing, and we are able to record a maximum elbow flexion isometric strength at 90 degree when the elbow is at the extended position. And this is the RMS of the bicep here, and there is no changes there. I have not applied statistically test here, but still we can, by visual method, we can see that not much change is there in the RMS. And in the same way, we have done also the isometric elbow extension strength at different shoulder angle, that is flexion, neutral, and extension. And here you can see that approximately around 90 degree, there is a little bit increases there, but there is not much differences there. And the same pattern is followed by the RMS for the extension. See, the RMS of the extension is approximately following the strength curve. This we have already seen for this one also. This is the extensor, that is tricep. And this tricep is approximately following the strength curve of the tricep. This is the strength curve of the tricep, which is a little bit inverted is there, but it is not so very clear. But still, we can see that the RMS is following approximately the strength curve, which is not there in case of bicep and elbow flexion. So same thing we are able to see in the shoulder flexion and extension also. So by using this device, we can also measure endurance timing also, muscular endurance timing. Muscular endurance timing is the from the start of the contraction, time taken from the start of contraction to the arousal of the fatigue, or when he or she is not able to do the isometric contraction at a particular percentage of the maximum voluntary contraction. So here we can say, we can find out what is the effect of the joint angle on endurance time in second. Y-axis in the endurance time in second. This is the elbow angle. This is for flexion. So we can see that we have done the experiment in the three percentage of the MBC. That is, the blue is for 20%, green is for 50%, and red is for 80%. And red here you can see that the endurance time is very less because it is 80%. But here we can see that when the elbow flexion is there, that is 130 is the elbow flexion is there for 20° MBC, the endurance time basically decreases. And what is the reason, physiological reason behind it? We are searching, and we will be publishing all this data very soon in a separate paper. In the same way, if we do the endurance timing for shoulder extension, this is the one, that is the elbow angle, and this is the endurance time for shoulder extension. And here you can see that this is the blue one. Blue one is a 20% MBC. This is 50%, and this is the 80%. So approximately, the endurance time is approximately increases as compared to 50 and 30 at 90°. Here you can see at least for 50% MBC and 80% MBC. Same case in case of bicep for 50% MBC. So what information we are getting from this? It is very important, because in designing of any ergomatics or some instrument which we are able to do sustain isometric contraction, then we may be able to provide the ideal angle where the fatigue resistance is maximum. So here the fatigue resistance is maximum at 50% of MBC at 90°, because the endurance time is maximum here. In the same way, the fatigue resistance, the angle is 90°, and it should be at 50% of MBC. If we change the MBC, then entire relationship would changes, especially for 20% MBC, where the endurance time decreases when shoulder flexion is there in extensor, in flexion as well as in extensor. So this is the one. And we can also use this machine for fatigue analysis also. All this can be incorporated in the PG, PG practical as well as research activity for the PG. So this is an one single data here. Here you can say this is isometric force in Newton, and the person is holding at 20% of MBC at 130° of elbow flexion. So the person is holding at 20% of MBC, and the angle of the elbow is 130°. And here this is the row EMG of the bicep. So in order to do the fatigue analysis, we can you can select the first 50 second or middle 50 second or the last 50 second, and you can do comparison between the first and last, because at the last fatigue will be there. And this is visually we are able to see visually where increase this activity is there when fatigue is arising. So in order to quantify that, we can measure the RMS of the first 50 second. Here you can see that the RMS is less as compared to the last 50 second. RMS is greater. I have not applied statistical test here, but still you can see that the RMS is greater. But all the median power frequency and the mean power frequency is decreases as compared to the first 50 seconds. So classic fatigue example is there. So by using this instrument and a simple ADI and lab chart, you can demonstrate the classic example of the fatigue, where you will find all the EMG finding related to the fatigue. So this is another strength for our instrument. So the utility of our instrument and the strength of practical is, number one, performing of isometric exercise, whether elbow or knee. I have shown only for elbow. At different knee or elbow angle is there. And also angle specific isometric training can be there, because the strength of the muscle depends upon the angle. So angle specific is there. This is very important in case of fitness or sports. In case of the sports training and sports performance, angle specific isometric training can be given to them, and we can approximately evaluate the strength curve and endurance timing for elbow as well as knee. And this concept of the strength training, as we have already shown, it may be a possible valid replacement or in addition to the classic animal physiological experiment, where we do length tension relationship. So this may be an alternative, very simple, very easy to do, non-invasive human experimentation. And the most important thing is in case of the applied aspect, we can teach the PG as well as the UG students regarding the importance of the strength curve and the sports performance, related with the sports performance, or the applicability in the future for muscle prevention and muscle rehabilitation. Like we already know, at a particular angle, the force of that muscle is maximum, or the endurance time is maximum, where the fatigue resistance is there. So by knowing all these things, we can do injury prevention as well as rehabilitation, and also designing new equipment like ergonomics may be there. So for optimizing the output of the muscular force as well as fatigue resistance. So I just want to give some basic example which we can show to the undergraduate as well as postgraduate. Here, this is the basic strength curve. This is the isometric torque, and this is the inverted U shape, which is in the ideal condition of a single joint, just like a bicep curve. Now, this may be the isometric strength curve may also be ascending, where this is the range of exercise range of motion. This is an example of the all the pushing exercise, like the bench press, and the bench press, and also squat also. Here, what is the application of that? The application here, we can see that at the start of the exercise, the force production is less. Here you can see, and the force production is increases with the increase in range of motion of the exercise. That is, the force production will be minimum here when the starting position, and it will be maximum at the end position. So in order to load the muscle optimally in the starting of the exercise as well as in the end of the exercise, we can hang a chain also, or we can use a resistant band also. How does it work? When you are at the starting position, the weight of the chain, it is supported by the gravity, but as you pull off, then as you push, then what will happen? The weight of the chain will be added to your bar, and hence your loading of the muscle will happen here, where you are able to produce more force. That is the principle of the optimum loading of exercise training. So in the same way, here is also the same thing, where resistant band or a weight can be hanged, and same concept is there. When you're starting, when you don't have much ability to force, then no problem. But when you increase the exercise, then more the force by this resistant band or the hanging weight will be added to the muscle, and hence optimum loading of the muscle can take place in entire range of motion. So but one problem is also there, since see the tearing of the pectoralis muscle can happen. You can see, and tearing is happening where? At the initial phase. Why? Because initial phase is the phase where the muscle is not able to produce optimum force. That's why if your external force is too much, then it may cause injury also. This reason, it is known as sticking reason. So this concept can be used for injury prevention as well as rehabilitation and exercise training also. Same thing if the force, if the strength curve is, the decreasing in concept, that is at the starting of the exercise, if it is higher, then at the end of the exercise, if decreases, then we can, manipulate, the exercise, that particular exercise, by doing different maneuvers, and all this all these exercises which are pulling in nature, they generally follow this type of the strength curve, where your maximum force, your ability to generate maximum force at the starting of the exercise, and at the end of the exercise you are not able to produce much force is there. So by using manipulating this different muscle, the different exercise, you can optimally load the muscle. This is a classic example where you can manipulate by using this momentum. The momentum which I talked in the earlier slide was moment arm for the internal force, that is for the bicep. And here the momentum I am talking is the external momentum here. This is the bicep curl, classic bicep curl. And if you do a standing bicep curl, then what will happen? The momentum is the green is the momentum. It is the perpendicular distance from the line of force. This is the gravity is there because of the resistance is there, and this is the the axis of rotation. This is the momentum, and you can see that the momentum is maximum here, maximum at the approximately 90 degree. So if you do standing bicep curl, then your momentum is maximum at approximately 90 degree, and hence the resistance offered by this external weight will be maximum at that point. And we already know that approximately 90 degree, the bicep or the elbow flexion has also the capability of producing maximum force. So this exercise can be used to load the bicep. But what happens if you do, the pacer curl? In case of the pressure curl, you can see that the momentum is maximum here. That is at the, at when the bicep is stressed, it is a more stress position by just adding a bench. So by manipulating different exercise and knowing the strength curve, you can, design your exercise in such a way that it can optimally load the muscle at the starting or at the, depending upon your joint angle. So this concept is important. It is very important, not only for, every exercise physiologist, UG or PG, or who want to do further research, and also for the sports training also. So this practical, this UG, this our practical was included as a part of UG and PG physiology practical manual at AIIMS New Delhi. I was very fortunate, and this has been regularly done by their UG and PG at AIIMS New Delhi, and we are planning 22 set IMS DHU also. So thank you very much, and once again I am very thankful for giving this opportunity to present the work, and also the Professor K.K. Deepak, because sir guidance is immense, and sir is always there to support any new idea. Motivation is maximum. So thank you very much, sir. Thank you.